Hi, I'm Carolyn. I'm a personal trainer and I specialise in working with people who have had cancer. This is a second film on how you can do upper body training in order to recover strength and flexibility after breast cancer surgery. It's intended for women who've had wide local excision, who've had lumpectomy, simple mastectomy, total mastectomy, but without reconstruction, and also axillary surgery. It's safe for all of those, for exercise after all of those procedures, but not those who've had reconstruction. We do different exercises for that. So there's a film already which is exercises that you can do immediately after surgery and in the second, third week or so afterwards. I would recommend go through those first, and they act as a really good warm-up to then moving on to slightly more strenuous work, kind of weeks 4, 5 and beyond, if you want to try to recover certainly flexibility and mobility, range of motion in your shoulders, but also some shoulder and upper body strength. So I'm assuming you've gone through that film already. Please do, as I say, and use it as a little warm-up. Beyond that, what we're going to do is look at bigger movements within the shoulder and the upper body, and also thinking about all the different complexities. If you think of all the different directions that you move your arms in, is to look at all the different functional movements that we need and then apply strength training to them. So assuming you have done some warm-up already, we're going to think about movements like this. So if you have your hands kind of by your shoulders and we push, okay, so we're going to do just half a dozen or so pushes like this, just to make sure that that feels okay. And from there, this can, almost all of this anyway, can be done seated if you wish, rather than, I'm seated rather than standing. We're going to have the hands down by the hips and we're going to bring the arms up. Now, you may well find, most of us are asymmetrical anyway, but you may well find an even more noticeable difference in how far and how reasonably you can move your arms post-surgery. That is, of course, really normal. I've seen it in countless women after breast cancer surgery, that one arm just, for a fair while, it just doesn't do as much as the other. The surgery side is so affected in so many ways. So be mindful of that. It will happen. And what we're going to try and do is just try to rebalance it a little bit. We're going to bring the hands here by your shoulders, and we're going to take the arms straight up over the head if you can. Now obviously this is quite a tough ask. I'm filming this 6 weeks post mastectomy, and I must admit I've worked really hard to be able to do this, to be able to bring my arm right up. So if that's as far as it's going to go today, then please don't overdo it. We're just going to go as far as your arm is willing to do. And the thing that I must say has surprised me is where you feel this movement post-surgery. Definitely feel it on the chest wall, feel it right under there, don't you? So as far as is a reasonable ask, no further. We're going to straighten the arms right in front and bring the fists straight up to shoulder height. Doesn't need to go any higher, but to there. So side angle is here and up. Okay, try and sit tall in your chair if you're seated. Try and hold the belly muscles firm, try and hold the back long, because if you can, then all the while that we're doing this, we're also asking our core muscles to keep us nice and strong and stable. So we're working them. So we're training the belly without having to do any sit-ups, which is no bad thing. Okay, we're going to take the arms really, really wide. Now again, as far as feels right for you for today. I expect you to feel the stretch across the chest muscles and also on the front of the shoulder here. We're going to take the arms as wide as is comfortable, and then without necessarily engaging the elbow. My elbows are soft, they're not, my arms aren't locked, but I'm not using the elbow, I'm using my shoulder muscles to bring my hands together, and I'm squeezing here, I'm squeezing my pectoral muscles. Might fit, again, you may well feel a difference on the surgery side, if indeed surgery was just on one side. But a gentle clap, as I say, squeezing here. The muscles that are kind of underneath your bra straps, I guess, those muscles, front of the armpits, we're squeezing. Okay, one that is standing, and it's a little press up against a wall. Now, on the balls of your toes, have your hands shoulder width and shoulder height. We're going to lean into the wall and back out. And what you're trying to do is keep your body in a long straight line. So what some people do is reach in like this and use their hips. So there's no movement around the bum, no movement in the hip or the back. Your whole body in a straight line comes in towards the wall, and you're bringing your arms, your elbows wide as you dip in. If you've done martial arts, or if you've, some of us will happily do a press up that way. What we're trying to do here is with the shoulders, with the hands, shoulder width, shoulder height, coming in and out gently. Actually, standing, because it's a little easier to see, we're going to bring the fists so that they're close together, so my thumbs will reach, and I'm going to draw my fists up towards my armpits. No further, but what this is a movement, you'll feel it around the ribs, movement into the armpits. Just half a dozen or so, as I say, just getting used to a different complexity of movements around your armpits, rib cage, etc. And then the triceps. So sharp bend on the elbow and bring the elbow as high as you comfortably can. This is a tough one post-surgery, and I know this. We're going to raise the hand right above and then bring the hand down behind the head. So I'm using these muscles here, and they're at full stretch right now. If it needs to be here, if that's as far as you can go, then perfectly fine, don't worry. But what we're trying to do is bring the upper arm as vertically as is reasonable, and then raise the hand right above the middle of the head. Okay, I'm doing this on my surgery side. You may well want to also engage the other side, just to keep it all moving. Okay, and then from here we're going to lower the fists, keep the elbows right in by the ribs, and we're going to do a little bicep curl. Here we're going to flay the fingers out and bring them back down. I have half a dozen of these. So I'm doing these with my palms. As I raise my hands, my palms are facing upwards. I'm now going to turn my fists so my thumbs are upwards and do the same. The fingers business is all about, it's one method that's thought to just help encourage lymphatic drainage. We're already doing that to a degree because we are moving the shoulders anyway, but if you've got any risk of swelling, it's just one little technique to add into what you're doing, just to help keep things flowing. And then we're going to tip the wrists again, so the knuckles are upwards, and similarly raise the fists, some little flicks, and back down again. The elbows aren't coming up. Sometimes people will do this, whereas it's not, the elbows staying by your ribs. Okay, and then if it feels reasonable, we're going to try and bring the hands right above the head to fist the shoulder width, and then we're going to pull down. So my fists are travelling in a diagonal, almost an arc actually, but in a diagonal line, and I'm pulling my shoulder blades down and low, still sitting tall. Okay, and then last one is to hold the hands together. We're going to bring them up if you can. If you can't, if you need to quit by now, it's perfectly fine, because this is asking quite a lot of your mobility. We're going to tip the fist behind the head and bring it up. Okay, so if I really don't want you to hurt yourself, so if this is too much today, we'll work up to it. Okay, so second level of mobility training for the shoulders and upper body after breast cancer surgery.